Hello, everyone. Today I'm going to talk about why expanding Medicaid is important and how it can improve healthcare access for low income populations while reducing health disparities and strengthening communities overall. My name is Jalen Glass. The problem healthcare is way too expensive. Healthcare costs continue to rise, making it difficult for low income individuals to afford insurance or basic services. This causes many people to delay or even completely avoid care. Why it matters: delayed care equals worsening outcomes. When people delay care, small health problems can quickly turn into serious conditions. This leads to more complications and increases the need for emergency medical treatment later on down the road. The population I'm focusing more on in this presentation are low income families. This issue mainly affects low income individuals, families, children, older adults, and people with disabilities who often have fewer resources and limited access to consistent healthcare services. In reality, basic needs versus healthcare, more individuals are forced to choose between paying for basic needs like food, rent, transportation, and going to the doctor, which in the long run creates long term health challenges. Over 28 million people, Americans, have skipped meals to pay for healthcare last year. One of the root causes is mainly high costs. It makes it difficult for individuals without insurance to receive regular medical care because it has been increased so much throughout the years. Another root cause is the coverage gaps. Coverage gaps mainly exist in states that have not expanded Medicaid, leaving many individuals without access to affordable healthcare services. Another root cause would be enrollment barriers. Even when people do qualify for Medicaid, confusing applications and lack of support can prevent them from enrolling and maintaining coverage. And the consequences of that is definitely worse health. Without access to healthcare, individuals experience worsening conditions, increased chronic illness, and reduced quality of life over time. Another consequence is also higher costs. Delaying care leads to more expensive or emergency visits and increased healthcare costs overall. It also contributes to higher mortality rates among low income populations. Um, Unmet needs is access to care. A major unmet need is access to affordable and consistent healthcare services, especially preventative care that helps avoid serious health problems. One thing that has been done is Medicaid expansion. Some states have expanded Medicaid, which has increased coverage and improved access to healthcare services for many individuals. The gap, it's still not enough. Even though some states have already expanded Medicaid. Not all states have, and many individuals still face barriers to accessing healthcare services. There are still 10 states that have not adopted or implemented Medicaid coverage. Policy options would be expand or to stay the same. We can either keep current policies or expand Medicaid to improve access and reduce disparities among low income populations. The best option would be to expand Medicaid. Expanding Medicaid is the most effective solution because it increases coverage and improves health outcomes at the end of the day. The vision, healthcare for all, and leave no one behind. The goal is to create a system where everyone, regardless of income, has access to affordable and reliable healthcare services. The strategy, expand and simplify. This includes expanding eligibility, simplifying enrollment processes, increasing provider participation, and improving outreach so individuals understand available healthcare resources. Social work values for this would be social justice. This change supports social work values by promoting equity, dignity, and equal access for all individuals. The impact of this would be basically building stronger communities. Improving healthcare access leads to healthier individuals, stronger families, and more stable communities. Call to action, act now. Policymakers must act now to expand Medicaid and improve healthcare access to reduce disparities and improve health outcomes.